Hello, everyone. Thank you so much for joining. So today we're going to be talking about vaping. Let me just get my PowerPoint started. All right. So what exactly is vaping? What are e-cigarettes? E-cigarettes are also known as ENDS, which is electronic nicotine delivery systems. They're battery operated. They use a heating element to heat an e-liquid from a cartridge that's usually refillable, releasing a chemical-filled aerosol. They're generally smokeless, flavored, and designed to vaporize either nicotine or THC. Generally, they tend to have a non-detectable odor and tend to be more discreet than cigarettes. So the big question is it safer or better or less addictive? The honest answer is the FDA has not found any e-cigarette to be safe and effective in helping smokers quit, although that is how they were often being promoted. This has never actually been proven. They also tend to be addictive, especially when paired with nicotine or THC, and it can predispose to other addictions as well. And as we know, tobacco is one of the leading causes of preventable death in the United States. About 438,000 US deaths each year can be directly related to smoking. And that's exactly what this chart shows, along with other things, as you can see, going down. But tobacco really is the leading preventable factor here. So often vaping, it's promoted as a lifestyle. It's kind of promoted as the road to redemption, taste the power, feel the freedom, live the dream, live extreme. These are just different ways that we see vaping promoted out in the community, on social media, from person to person. You'll hear things like live long and vape strong. It's not very it's actually very common to see some of these, especially on social media, amongst the young crowd, absolutely, who, as you know, have been using social media so much to promote all sorts of things. And so, the big question is, why is vaping becoming popular? Because what it leads back to is who's going to replace the old smokers. We've had so many campaigns about how cigarettes are bad. They cause lung cancer, skin changes, all of these different health risks. And, it's being in basically advertisements, social media. It's not considered, now the as socially acceptable as it used to be back in the day. So that is where our vaping comes in. The e-cigarette and the vaping companies know that many of their customers are getting older and need to be replaced with new customers so they can make more profits. So who do they see as their ideal customer? It's young people and people of all ages. 88% of adult smokers started before the age of 18. And, oh, let me go back there. And it's the young people often that these companies target, as well as mid-age adults. The e-cigarette and the vaping industry see these young people as the perfect replacement customers. They know that if young people get hooked to their products early in life, they'll have them as customers for years and years to come. It's well known by health professionals and the e-cigarette and tobacco industry alike. Many current smokers started smoking even before adulthood. So if you take a closer look at e-cigarette and vape pen marketing, you'll notice the advertisements, the ways that this industry appeals is to make the e-cigarettes and vape pens seem trendy, to make them seem cool and appeal to the general population. So, advertising and exposure. 7 in 10 teens are exposed to e-cigarettes in advertisements, about 68% in retail stores, 40% online, 38% on TV, and 24% in newspapers and magazines. It's often a provocative, alluring advertising. And as we move on to the next slide, you can see that youths are exposed to e-cigarettes from multiple sources. About 14.4 million youth are exposed at retail stores. About 10.5 million are exposed through the internet, 9.6 million through TV, and 8 million through magazines and newspapers. US students exposed to e-cigarette advertisements by school type and number are in the graph below. So as you can see, overall, about 69%. When you break it down between middle school and high school, it's 66% of students in middle school and 71% in high school are exposed to these advertisements. And it breaks it down by all the different sources. And as you can see, they're exposed to this from so many different sources that they often turn to, such as TV, magazines, internet. So when you put all of this together, you can see how much is being put into advertising these e-cigarettes. And some of the common reasons why youth say they smoke, 39% say friend or family member uses them, 31% do it for flavors, 17% do believe that they're less harmful than other forms of tobacco. And there are other reasons, such as peer pressure, fitting in. It's considered being original, trendy. It's considered being sexy, as you can see in this picture here on the right. So these are some of the common ways that they attract youth, as well as adults, to the e-cigarette industry. So youth who used Juul flavor pods in the past 30 days said they obtained the device in the following ways. About 74% used it from a physical retail location, and about 52% from a social source, about 6% from the internet. And the youth could select multiple answers in this quiz that was done. And there are over 15,500 unique e-juice flavors that are available online. So what are the usual suspects? Some of the brands behind these new products are actually the same corporations that have produced traditional cigarettes. So the company that sells Newport is the company that sells Blue. Marlboro sells Mark 10, and Camel sells Vuse. So basically, these big tobacco corporations are replacing their old cigarette customers as cigarettes start to be less socially acceptable with new customers that they hope to keep for a lifetime by promoting a new product. And the worst part of it is sometimes these get promoted as being a healthier alternative when they really aren't. There are so many flavors. And besides the large aerosol clouds that can be made with e-cigarettes and vape pens, these e-juice flavors are often a marketing strategy to lure new customers. So, who do we think is most likely attracted by these flavor options? It's no coincidence that a lot of the flavorings, I'm sorry, I don't think this popped up. A lot of these flavorings are ones that are popular among young people. And they're often marketed as being trendy products, as you can see here, with so many different designs, ways to personalize. And when you look at these, it makes you wonder, what age exactly are they trying to target? And it's clear from some of these products that they're designing, some of these flavors they're designing, that they're trying to target younger and younger people. And as you can see, even middle schoolers are heavily exposed to these advertisements. So then the question becomes, how much are they going to keep pushing it? And I just want to bring up some examples of how they do targeted marketing. So as you can see, e-cigarettes and vape pen companies try to recruit new customers by sponsoring events that are popular among young people, like music festivals. Sports fans are targeted through brand sponsorships, or indirectly attempting to associate e-cigarettes and vape pens with sports themes. And as you can see, electric lounges and different social ways that would be considered cool and trendy. So what this graph shows us is that teens are starting to use vaping devices in record numbers. And what exactly do teens say they're vaping? So as you can see there, nicotine And these are broken down by the different grades. So you have your eighth graders, your 10th graders, your 12th graders. So these are the percentage of teens that are saying that they're vaping nicotine. These are the percentages that are vaping marijuana or hash oil. And these are the ones that are vaping just flavoring. And in the past year, these are the percentages of teens vaping in different grades. And nearly 2 in every 5 students in the 12th grade report past year vaping, raising concerns about the impact of brain health and potential for addiction. So as you can see here, our electronic nicotine delivery systems, they come in many shapes and sizes. Some of them cigalikes that resemble cigarettes. You have vape pens, you have mods, you have advanced personalized vaporizers that will allow you to customize many features, including temperature, nicotine content, e-liquid, e-cigars, pipes. There are pods that are very small and discreet. And moving on to the next slide, you have egos and tanks. So next came the first tank style e-cigarette with higher capacity batteries. They're often called vape pens. And they have a tank which allows the user to refill it with e-liquid. Once compatible, the user can then change the battery, tank, atomizer, and even the mouthpiece or drip tip. The One of the problems with some of these pens is that the e-cigarette and vape pen batteries can actually explode unpredictably, posing a fire hazard, which is why a lot of the airplane companies have started banning passengers from carrying them on planes. The user can also regulate the frequency of the puffs and create bigger amounts of aerosol if they want, which is basically the fog that is produced. And what that means is more aerosol, nicotine, and other chemicals can be breathed into the lungs and at a faster rate. So going on to the next slide, here are your mods, your personalized vaporizers. And now these are large size, modifiable e-cigarettes that are often bigger than egos and vape pens. They're commonly referred to as mods, drippers, RBAs, RDAs, or even RTAs. RBA stands for rebuildable atomizer, RDA stands for rebuildable dripping atomizer, and RTA for rebuildable tank atomizers. So these allow users to change battery voltage or power, or even build their own coils using resistance or low resistance wires, such as Canthal. Some have large tanks. Others don't have tanks and instead have cotton or silica wicks weaved between the coils on which the e-liquid drips. So these are your drippers or RDAs. You can have modifications to voltage, power, wire resistance that allows the atomizer to reach higher temperatures, which increases the amount of nicotine and other chemicals delivered to the body. Although these can deliver even more aerosol and nicotine to your lungs, they're popular because of the large aerosol clouds that they make. All right, going on to our next slide, which is the e-juice and the e-liquid. So they are often used interchangeably. Some people refer to it as the e-liquid and some call it the e-juice. This is what is put into the e-cigarette or the vape pen devices and often has flavors and nicotine or THC. The e-juice is heated inside the device, and that's what creates the flavors and aerosol that is then inhaled into the body and out into the air. And so often the e-liquid components are broken down into flavoring, nicotine, glycerin, and propylene glycol. These are some of the common components found in these e-liquids. And next, let's see if I can make this video work. This little video shows you basically how the device is set up. Right. Oops, my apologies. All right. So, what are some of the unique challenges that we face with e-cigarettes and with vaping? So they're more difficult to detect than traditional cigarette use, as they usually have a smell and an aroma that's similar to some of the flavors and smells that we may see on a day to day basis. They don't have the traditional cigarette smell, which makes them more difficult to detect. These devices are often designed to look like normal student belongings, such as flash drives, pens, which also makes it harder for teachers, parents, and others to essentially detect them. Um, and the messaging of manufacturers and distributors is what makes it another big challenge. They market them as being safe or a safer alternative to cigarettes. It's not uncommon that we have patients ask, "Hey, doc, I want to stop smoking cigarettes. Should I start vaping? Is that safer for my lungs?" And they get marketed as just being water vapor, as a healthier way to stop smoking cigarettes. And in addition, the social media depicts them as being cool. It's a product that's considered cool by not only teens, but by many adults. It's the cooler way to smoke, it's the healthier way to smoke. It's kind of promoted as the more organic version of smoking. And so much so that they don't even label it as vaping, as smoking. They gave it a new unique name, vaping, which makes it sound less harmful and more organic, more safer for your lungs, which it truly is not. And moving on to another popular form of smoking, hookah. Many of you may have heard about it. It often tends to have a big social component to it. So, what exactly is a hookah? So on the right, I have a picture of it. This is essentially what it looks like. There can be different versions of it. Sometimes some of them may have multiple pipes, but essentially what it is, it consists of four parts. One is the base, or the smoke chamber, which is partially filled with water. There is another bowl that contains tobacco, and there is a heating source there. There is a pipe that connects the bowl to the base and dips into the water in the base. And then there's a hose, a second tube in the pipe that does not dip into the water but opens into the air in the base and allows users to inhale the hookah smoke. And these are basically water pipes that are used to smoke, specially made tobacco that comes in different flavors. And often there are hookah lounges. And so that's where it becomes a social event where many people, and some cultures, it is a lot more prominent than other cultures. Now, it's not uncommon to hear people say, "Oh, I only do hookah once in a while, once a week, once every few days." But the honest truth is, when people do smoke hookah, it's a social activity that goes on for a few hours, and that still is smoke inhaled into the lungs. And at that point, it becomes hard to regulate the amount of nicotine. Not only that, but it's not uncommon for people to pass the hookah pipe from one person to the next, which also predisposes people to infections, especially with so many viruses going around, with COVID, with flu, with RSV. So these are some of the unique struggles with hookah as well. And as I said, with hookah, the smoke gets inhaled in a typical 1 hour hookah session and can equal 100 cigarettes or more. And even after it has passed through water, the tobacco smoke in a hookah pipe contains high levels of cancer causing chemicals. So, moving on to our next slide. So the vaping company, the e-cigarettes, the disposable electronic hookah, um, they kind of market it as one big happy family. It's the industry leading 700 puffs, 6 second shut off protection, regulated voltage to ensure consistent taste, a flat button that prevents accidental usage in pocket. But as you can see, they've made it into such a small electronic device, and that is disposable, making it even easier for people to carry it around. And as you can see, the flavors, they're very addicting, and as you can see, they're kind of paired with some alcohol related drinks as well, that may be favorites among some people, kind of drawing to that crowd as well. So how exactly does an e-cigarette work? So like I said, oops, I'm sorry. I think I went over a little bit of this earlier. My apologies. I think I repeated this slide by mistake. But essentially, like I said earlier, there's a cartridge or reservoir pod which holds a liquid solution and can contain different things, nicotine, flavorings, and then there's a heating element. There is a power source, usually a battery, and a mouthpiece that the person uses to inhale. Puffing usually activates the battery-powered heating device, which then vaporizes the liquid in the cartridge. And the person using the vape then inhales the resulting aerosol or vapor, and that's what's called vaping. So kind of moving on to the next slide, we have the picture of the electronic cigarette broken down here. So this was an electronic cigarette that was developed by a Chinese company. It gives the user nicotine, but no fire, no tar, no carbon monoxide, no ash, no stuff. That's how it was marketed. You have a light that simulates a cigarette glow. It indicates when the device is ready for use and works as battery indicator. You have your battery here. You have electronic components such as control circuits, pneumatic airflow sensors. And then next you have a vaporizer that atomizes the nicotine smoking liquid in the liquid container. And next you have your nicotine liquid container. And last, you have the inhaler where the user can inhale the vaping vapes and such. And just kind of, if you look to the bottom of the slide, you can see the electronic cigarette. So one e-cigarette can be equivalent to 6 to 7 regular cigarettes. And you can have 100 puffs per cigarette, which would equal about 15. And 6 to 24 milligrams of nicotine in the electronic cigarettes compared to your regular cigarette. So as you can see, sometimes when we use these electronic cigarettes, we may not even realize how high of an amount of nicotine level we truly are using. And so moving on to the next slide. So as you can see, this electronic cigarette is made to look so much like a cigarette, and it's marketed as being safe, as being fashionable, as being healthy. And as you can see, it truly is marketed to look just like a cigarette, making it equally addicting, making it tempting to smokers as a way to transition from cigarettes to vaping. So then the next question that comes up, the e-cigarettes and vape pens, is it just water vapor? For so many years, consumers were told that the clouds that were made were just water vapor. Do you really think it's true? Nope. These clouds are not as harmless as the companies would like you to believe. It's an aerosol, not just a vapor. The e-cigarettes and vape pens allow users to make large clouds that many think are just water vapor. In reality, the cloud is a mixture of many different chemicals that were either present in the e-liquid before or produced during the heating process. And a vapor is a chemical that has evaporated. An aerosol is a mixture of liquid particles suspended in a gas and can contain many chemicals. So that's the true difference between the two. Even though it's marketed as just water vapor, it truly is not. It's a mixture of different liquid particles that get aerosolized, that then get into the lungs of whoever is breathing that aerosol in. And instead of just mixing with the air like a pure gas, aerosol can leave drops behind. So, what is an e-cigarette aerosol? It can have nicotine, It can have ultrafine particles that can travel to your lungs down to the smallest levels of the air sacs that do the breathing in our lungs for us. It can contain volatile organic compounds, cancer-causing chemicals, heavy metals such as nickel, tin, and lead. Flavorings such as diacetyl, a chemical linked to a serious lung disease. Next, aerosol versus vapor. So aerosol, like we talked about, is a liquid or solid composed of finely divided particles suspended in a gaseous medium. It contains nicotine, propylene glycol. Propylene glycol is FDA approved for use in some products, but inhaling propylene glycol is in vaporized nicotine is not. And some studies do actually show that heating propylene glycol changes its chemical composition, producing small amounts of propylene oxide, which is a known carcinogen. You have fine and ultrafine particles that have been found in higher concentration than even cigarette smoke. There's exposure to fine and ultrafine particles can constrict arteries, can trigger a heart attack, and they can cause respiratory problems like asthma, or if you have asthma, can make them worse. The short-term use has been shown to increase respiratory resistance as well as impair lung function. Nanoparticles can pass through cell walls, unlike other particles, and volatile organic compounds that we went over, like gasoline, can cause cancer. And like I said earlier, vapor would be just cloudy diffused matter, such as mist, steam, fumes suspended into air, but that's not what's in these vape pens and these electronic cigarettes. So, what exactly is propylene glycol? It's found in antifreeze, de-icing agents in cars, planes, and boats. So then the question becomes, is this what we want to put into our lungs? If I asked you to inhale this into your lungs, most of you would look at me like I'm crazy. But this is actually what they do put in some of these e-cigarettes and these vape pens. And studies have shown that inhalation exposure to glycerin does affect airways. Short-term exposures can cause eye, throat, and airway irritation, and long-term exposure can result in children developing asthma. So it not only affects you, but can also affect others around you. So what are e-cigarettes, vape pen, aerosol composed of? So this is a list of chemicals that can be found in e-cigarettes and vape pen aerosols. And as you can see, it's a pretty extensive list. And sometimes these can be in very small quantities, so you may not even see them reported. So moving on to our next slide. So vitamin E acetate. So this is something that is safe when it's ingested or applied topically, but it is used as a dilutant or thickening agent in some of the THC-containing e-cigarettes or vaping products. When vitamin E acetate is inhaled, it contributes to lung injury and it interferes with your lungs' normal ability to function. And this is something that we can detect when we collect a fluid sample from your lungs by doing a procedure called bronchoscopy. So you can see that it does get deposited, it does cause damage to your lungs. So the question is, nicotine and Juul. Nicotine is a poison. Large amounts of nicotine are lethal, 60 milligrams in adults and 6 milligrams in children. It's also an insecticide and toxicant. The number of poisoning cases linked to e-cigarettes liquids was 1,351 in 2013 and a 300% increase from 2012. According to the National Poison Data System, these numbers were expected to double by 2014. And nicotine, as we know, is an addiction. 5% nicotine equals 59 milligrams per milliliter. A regular pack of cigarettes contains 8 to 20 milligrams. And these are often facts that young teens, that middle schoolers, that high schoolers, when they are picking up those electronic cigarettes, those vaping pens, they don't quite know. And they don't realize exactly how much nicotine is in these products. They have flavoring. And many of the users don't even realize that these products contain nicotine. They have nicotine salts that allow nicotine to be delivered at higher concentrations without the throat irritation that people usually get from cigarettes, making it even easier to overdose with these electronic devices. Nicotine addiction. So nicotine itself stimulates your adrenal glands to release a hormone called epinephrine. It activates the brain's reward circuits and also increases levels of a chemical messenger in the brain called dopamine. And this reinforces rewarding behaviors, making it very, very easy to get addicted to this product. Pleasure caused by nicotine's interaction with the reward circuit is what motivates some people to use nicotine again and again, despite knowing the risks to their health and well being. And the adolescent brain is uniquely vulnerable to the rewarding effects of nicotine. So, what are some of the symptoms? 85% will initially experience respiratory symptoms, 57% can have gastrointestinal symptoms, and 76% can have accompanying symptoms such as fevers, chills, difficulty breathing. And some of the health risks to e-cigarettes and vape pen users. So based on current information, we know there are health risks when people use this product. The aerosols that are produced by the chemicals in the e-juice, they enter into the user's lungs and leave a chemical residue behind. Many e-cigarettes and vape pens have nicotine, which is known to have effects on the cardiovascular system. You can get ear, eye, throat irritation. And all of these are common among e-cigarette and vape pen users. And perhaps the most worrisome is the possibility of more young people developing an addiction to nicotine. Nicotine use in early adolescence causes changes in the brain that make lifelong addiction much more likely for young e-cigarettes and vape pen users, as at this age, their brain is still developing. And so they are very, very susceptible to this. And what are some of the side effects of nicotine? So as you can see here, it can increase your clotting tendency. It can increase the risk of your lungs to have bronchospasm, which is where your airways start spasming, and you in asthma, in COPD, you can have muscular tremor and pain. You can have gastrointestinal symptoms such as nausea, dry mouth, dyspepsia, diarrhea, heartburn. You can have joint pains. You can feel lightheaded, have headaches, sleep disturbances, abnormal dreams, nightmares, irritability, dizziness. These are just some of the side effects that it can have from a neurological standpoint. It can also affect your heart. It can either increase or decrease the heart rate. It can increase your blood pressure. It can cause arrhythmias within the heart as well as it can constrict the blood flow in the vessels that provide blood to your heart. It can cause insulin resistance or cause you to secrete higher insulin than is needed in your body. So as you can see, it can affect so many different organs in your body. It is associated with COPD, asthma, and other serious lung diseases. It damages blood vessels and the lining of those blood vessels. It increases the risk of heart disease, as well as it contains many heavy metals and carcinogens. So, vaping in the brain. So, one of the things that I've highlighted throughout is addiction. Addiction, addiction, addiction. Um, the vaping industry has built these electronic cigarettes to promote addiction so that they can have a lifelong supply of customers. Um, And this can also open the gateway outreach to other drugs such as methamphetamine or cocaine. It can lead to poor attention, mood disorders, impulse control. And lifelong nicotine addiction is very, very likely, especially as you can see, some of these devices can deliver nicotine at a much higher rate. Um, and So the next slide, it highlights that smoking saturates some of the receptors that cigarettes attach to. And that's what the different diagrams show you. And the nicotine from 3 puffs displays 75% of the tracer from the study participants' receptors. And the nicotine from these three cigarettes, nearly all. So EVALI, what does it stand for? You may have heard of this term. It's electronic cigarettes or vaping associated lung injury. There were about 2,758 cases of hospitalized patients with EVALI in 2020. 64 deaths have been confirmed, 70% were male, and 80% aged less than 35. More than 80% used THC containing products. 15% were under 18, 38% between 18 to 24 years of age, 24% between 25 to 34, and 23% are 35 plus. 13% exclusive use of nicotine containing products, and 35% exclusively used THC containing products. So how is it diagnosed? There's 4 criteria: the use of an ENS, which is the electronic nicotine delivery system, at most 90 days prior to symptom onset; pulmonary infiltrates, which are patches we can see on your lungs when we do a CAT scan or an X-ray; and any negative infectious workup, which includes checking for viruses such as influenza, COVID, checking for pneumonia. And if you're able to bring up phlegm, we collect that phlegm and we culture it. You may end up needing a bronchoscopy. And if that is done, then we do send that sample to see if we see things consistent with this diagnosis. We do an infectious workup also to include blood cultures to make sure that there's not infection within the blood that's giving these changes, as well as if there's HIV, checking for it and associated infections that can look similar, and essentially ruling out any other possible medical diagnosis as a cause. So some of the pulmonary complications that we can see from vaping and use of electronic cigarettes is lipoid pneumonia, which is where we see what looks like almost like a crazy paving changes on your CAT scan, and kind of looks like a ground glass change on your CAT scan. It can also look exactly how a pneumonia would look like. Another complication is something called hypersensitivity pneumonitis, which looks symmetrical on both lungs. And it essentially is like an inflammatory reaction within your lungs in relation to exposure to the chemicals in the electronic cigarettes as well as vaping. It can cause something called diffuse alveolar hemorrhage, which essentially refers to bleeding within the lungs. It can cause organizing pneumonia, and it can cause acute lung injury and diffuse damage to your lungs. It can cause something called acute eosinophilic pneumonia. And you can have pleural effusions built with that, which is where fluid collects around your lungs, and you can end up needing procedures to drain that fluid. So these are just some of the complications of vaping and using electronic cigarettes. And these are some pictures of what it looks like on your CAT scan. So all this white stuff you see on the different images of this CAT scan, that should not be there. Your lungs do not look like that. And as you can see, it affects the lungs so badly in all of these different cases. And so, what are some of the signs of vaping? How to pick up if a friend, a loved one, a child, or partner is vaping? They can tend to be very irritable, angry, impatient, anxious, have a hard time concentrating, weight gain, sudden interest in burning candles, sudden use of perfumes or colognes to kind of hide that smell from some of the flavors, increased thirst, desire for flavor, nosebleeds, and seeing unfamiliar looking USB drives, battery chargers, spare parts. And as we saw earlier, some of these devices are very, very discreet and designed to look like everyday objects. And that brings us to the next topic, which is third-hand smoke. So another way that e-cigarettes and vape pens pose a danger to people, other than the smoker themselves, is through passive exposure. Although it's not known yet whether secondhand smoke from e-cigarettes or vape pen devices is harmful, there is evidence to show that this smoke can be dangerous to others. Third-hand smoke is chemicals in e-cigarettes and vape pen aerosols that remain on surfaces in dust even after the vapor and aerosol are gone, and they react with other chemicals in the environment to form toxic chemicals. And these potentially harmful chemicals can be exposed to other people or animals through the respiratory system, through ingestions, through skin exposure. And small children, especially, are at risk of third-hand smoke exposure because they tend to put everything into their mouths and have much more vulnerable skin. So, as a parent, it's very important to know the facts about vaping, to talk to your kids, to set a positive example, to start a conversation, to answer questions, and to keep that conversation going. Um, so, influenza and EVALI. Influenza cannot be distinguished from EVALI, which is vaping induced lung injury by signs and symptoms, clinical features, at presentation, or by testing. Um, it often presents as an acute respiratory illness in a patient with a history of e-cigarettes or vaping and THC exposure. It could be caused by influenza viruses, other respiratory infections, EVALI, all of the above. And frequency of influenza occurring with EVALI is not known. And when talking about infections and vaping-induced lung injury, anything that's going to compromise your lungs is going to increase your risk of being susceptible. Smoking decreases your ability to really, really fight infection. The severity of illness seems to be associated with being a smoker or a former smoker. And what are some of the consequences of this? So as you can see in this picture, I tried to capture some of them. Yellow teeth, premature wrinkles, hair loss, hacking cough, bad case of the jitters, and as you can see here, very bad skin. And that brings us to the end of my presentation, and I would like to open the floor for any questions, concerns, any feedback.
Dr. Patel, could you share any of things that you have observed in the hospital with young children or young teens? I know I've heard about them getting double lung transplants, but from your experience.
Absolutely. So we have patients who have had vaping-induced lung injury. We've had patients who have basically destroyed their lungs, and sometimes it's not even a long time of vaping. And often one of the things that I've heard from them is, I didn't even know it would do this to my lungs. Everyone vapes, nothing happens to them. Well, you know what? Just like with cigarettes, there's no good way to predict how it's going to affect your lungs. And the honest answer is, once it affects your lungs, we don't have medications, we don't have things to reverse the damage that is done to the lungs. It's done, it's there. They end up having to refer to lung transplant centers. They end up on oxygen. When it destroys the lungs, we've had patients who have had multiple pneumothoraxes. And a pneumothorax is basically where a bleb or something ruptures in the lung, or there's some kind of puncture in the lung, and your lung collapses and air escapes around the lung and pushes the lung down. It causes pain in your chest. You end up having to go to the hospital. You end up needing to have a chest tube put in. And a chest tube is basically where we go through the skin and we insert a tube that essentially goes from the outside to inside around your lung, gets connected to a canister that then collects air. And this can happen repeatedly. We've had patients who have spent more time in the hospital and so much time and with so many complications that they ended up knowing every single one of us lung doctors personally. They knew everything about our lives, we knew everything about their life. They spent more time with us than with their friends. That is how much time some of these young patients have spent in the hospital. And it's and despite everything we've done, their life completely changed. They went from being a young person in their teenage years, in their 20s, who should be out playing with their friends, thinking about college, to now being on oxygen, now seeing doctors on a regular basis, being admitted to the hospital, um, spending so much of their life in the hospital with us, ending up needing lung transplants. And these are just some of the few cases that we've seen.
There's another question in the chat box. Can vaping cause aspergillus in the lungs?
So, any type of injury you do to your lung, whether it's from cigarette smoking, whether it's from electronic cigarettes, or anything else you inhale into your lungs, can predispose your lungs to any type of infections, whether it's bacterial pneumonias, viral pneumonias, fungal pneumonias, aspergillus. Any of these can become more common.
Another question. I was told that Capital Health Pulmonology does not treat or consult with children under 18. Is this accurate, and do you anticipate changing this?
So yes, it is accurate. As of now, all of the doctors, as part of the Capital Health Pulmonary Group, were trained through internal medicine route. So internal medicine route, we're trained to treat adults only. So that is the reason why we don't see children under the age of 18, essentially. I don't anticipate, as of now, we do not have a pediatric pulmonologist in the group. As far as I'm aware, I know some of the other local hospitals do have pediatric specialties, but as part of our group, we're all mostly adult-based practitioners.
Okay, thank you. Any other questions?
Have you heard of any hearing loss or hissing in the ear?
So I haven't specifically heard of hearing loss. Um, related to electronic cigarettes, but one of the ways that it could possibly affect that is some of these can irritate your sinuses. And when
Okay,
your sinus passages are affected, it can sometimes make your ears feel full and affect your hearing or give you those cracking or little bit of like when you have fluid in your ear kind of feeling.
okay. Have you heard anything in the ears at all?
Have I heard anything? Have I heard patients complain if they hear anything in their ears? Was that
Yeah,
the question?
like hissing.
I haven't heard specifically about hissing in the ears, but I
Okay,
have had people say that ears have felt full or they've suffered from recurrent sinus fullness that has made their ears uncomfortable.
okay. Thank you.
Thank you.
I
Another
have
question.
a,
Go ahead. I'm
sorry,
sorry. Go ahead. No, go ahead.
I have a question, and it is more of a follow-up to my two previous questions, or the question and the point that I made. So I don't know if first, thank you for putting this together. I had called in about a month or two ago and asked if you guys offered any support, any help, or any treatment for children, and the answer I received was no. I then asked if you had any suggestions, and I wasn't given any information. I found out about this seminar from my mother-in-law that read it in a magazine. So it's been helpful, and I'll take a look at the recording. My question is, if you have children, what would you do if you found vape pens in their rooms, besides talking to them and all of the things that you suggested here? Since the hospital doesn't have the capacity to treat or consult with children under 18 directly, what is available out there, and is that something that you might be able to provide as a follow-up, if not to me directly, to the community, just because as you probably know already, this is a major issue that is not even understood yet, and the companies are targeting children more than any audience, because if they can get them hooked, as you know, just like cigarette manufacturers did decades ago, they're going to get them for life, and it's unknown what the problems are. So I think you probably understand my question. I'm not sure if there is an answer, but wide open to suggestions. Thank you.
Yeah, and that is an absolutely amazing question because it it poses such a big question mark. What do you do when you find it, your teenager with these vape pens, with these electronic cigarettes? And the toughest battle is a lot of their friends, a lot of their social groups are doing this. So a good starting point would be their family doctor or a pediatrician, whoever they see as their primary doctor. Generally, they share a very close relationship with whether it's a teenager or whether it's younger. Um, and they're a good starting point. Because they share this close relationship, some of this has to come from a provider who is able to understand where they're coming from. Each one of us has a different personality. Even when I talk about smoking cessation or stopping vaping with my patients, from patient to patient, I use a different approach because there are people where I tell them, hey, these are all the terrible things that are going to happen to your lungs. I need you to stop now. You're in trouble. And they will stop. And there are people where if I take that approach, they will put up the strongest wall and we will get nowhere. So we work on a gradual cutting down program. And what happens is with teenagers, it's especially tough because they're at such a sensitive age. So what I would recommend is at least reaching out to whoever their primary care provider is, whether it's a pediatrician, whether it's a family doctor, starting out with that. The second part that I think there's absolutely a much stronger need for are targeting the schools, the areas where these kids spend the most amount of their time. It's with their teachers, it's with their friends. So having, I think, at some point, and I hope to become more involved with this in the community, but having schools reach out and have people give presentations to teens about vaping and about electronic cigarettes, just like how in health class they talk about these different things, but having a speaker come in and asking the school's guidance counselor or teachers for these events, I think will start putting it on the agenda at different schools.
Thank you for that. I hate to be in an interactive conversation with you here, given the audience, but I do appreciate what you said. In my case, my daughter's primary doc is part of Capital Health, did see her. We had a couple of suggestions, one of which was to follow up at the hospital. I don't think she knew that you didn't see pediatrics there. I wanted to see if she could be tested and stuff like that. I love the idea of outreach to the schools. I was going to ask you about that before you mentioned it, and I'm not sure what the barriers are you're facing that might be preventing you or others from Capital Health doing outreach to the community surrounding Capital, but I think that's an excellent idea. If that's something that you feel the barrier exists on the community side, I would be more than happy to help you break that down, at least in mine in Northern Burlington. And I think I could help you with that. But if the barrier is on the Capital Health side, I think there's a big need and a demand for it, and I think it will be widely accepted.
Yeah, absolutely.
Can I just add to that? In the community health education department, we are working on doing presentations. We're preparing them now to go out to the schools. And basically, I know in the Trenton area, they're targeting the middle school. So
that's
we are
where they
working on
need
that.
it. Yeah. And if I might offer some suggestion, if you are going to do that, I would concentrate on the content in the latter part of the session that you covered today that talks about the impact and what you're seeing and what it does to the body, as opposed to all of the things in the beginning, which the kids unfortunately and sadly already know all about.
Yeah, absolutely. And like you said, especially when we're reaching out to teenagers and kids, long presentations don't work with them.
Yes. And somebody asked, can this Zoom be shared? And I did put the link in there, that in about a week, it'll be out there that you can see this recording. And I also ask everybody to complete the survey, the Survey Monkey, for the evaluation. That's also in the chat box. And just to be mindful of time, I think we're almost out of time. So is there one last question, or?
What would you say to seniors? I know we've been talking about children, but how about if you're a little bit up in age and you've been a
So,
smoker and you kind of flipped over to electronic cigarettes thinking it's a lot less and it's not as bad? And how do you come across the seniors to tell them to stop? Just quit cold turkey, or
mm,
what's your suggestion?
so I think as a lung doctor, I'm biased. Anytime I see anyone smoke or vape, my first preference is to stop completely immediately. I pray and hope that every time someone walks out of my office, they never pick up a cigarette or a vape again. But I know realistically it's not possible. So I do it on a patient to patient basis. I talk to them. The first question I ask them is, so I go over some of the risks, especially from the senior side, all the side effects it has from the heart standpoint, as
Mm,
well as your lungs as well. So each one of us every single year loses a little bit of lung function, but when you vape, when you smoke, this becomes accelerated. And so those are the things I focus on in terms of risks. The next question I ask them is, are you ready to stop completely, let's say? And if they say, you know what, I don't think I can do that right now, then we work out a plan where by the time they see me again, I want them to have cut down by, depending on how much they're doing it and the reasons they're vaping for, to cut down by a certain amount, by a certain percentage or a number of days. And slowly we work on getting off of it completely based on where they are in their mindset, I think.
okay.
Well, thank you very much, Dr. Patel. And it was very, very good presentation. And again, I just ask you to complete the evaluation, because we do read everything and use them for future presentations.
Thank you so much, everyone.